Thank you for scanning the QR code for our poster at CSM 2023. We hope to take you through a real-life clinical scenario that will allow you to better identify and address AMI. So here you'll see a patient who is 10 days post-op knee surgery, and you can tell by just looking at his limb, there's a large knee effusion on the surgical side, as well as some noticeable atrophy of the quad and a visible lack of tone. When we ask the patient to complete a simple activity like a heel pop or a short arc quad, there's evidence of poor contractibility of the quadriceps on the surgical side. We can objectively measure this using a biofeedback unit. You'll see when he performs a short arc quad, he's only able to achieve about 150-200 units on the biofeedback device. It's a hallmark example of someone who's likely dealing with arthrogenic muscle inhibition. AMI is not just a local problem, but rather a complex neurophysiological issue. Therefore, the best way to intervene is to open and exploit, meaning we're going to use a disinhibitory intervention to open a window for improved neural excitability and increased motor unit accessibility. After completing the focal joint cooling, we ask the patient to complete some of the same exercises that we had prior to intervention. Subjectively, you will see improved quadricep activation. Objectively, we can bring back our biofeedback unit, and pre-intervention, the individual was achieving about 150 units. Post-intervention, he's around 400. In addition to biofeedback, we can also use muscular torque as an assessment of intervention effectiveness with pre and post measurements. Remember, if you're seeing post-surgical knees acutely, you're likely treating patients with AMI. A good rule of thumb is if the patient has atrophy, poor tone, joint swelling, and or pain, and is less than 3 months post-op, they likely have AMI. Please feel to reach out to Dave or I with any questions, comments. We love engaging and having thought-provoking discussions. We hope you guys enjoyed this unique poster.